together should invest in to ensure that our health systems are resilient and that globally we are much more resilient to any future public health emergency. First, as my colleagues said, pandemics do not respect borders, and we must work together to build our collective global health resilience and make collective efforts to remove social determinants of health across borders. We saw from the independent panel review that was co-chaired by her Honorable Helen Clark that we collectively did not succeed. It was actually a very damning report. We collectively failed, but we individually have done a great effort. So we need to invest much more on our collective effort. And Qatar, through its government arm, the Qatar Fund, and its charities, invests heavily in global healthcare resilience at individual country level, but also globally at the WHO and UN agencies. Second, previous pandemics did not address sufficiently, or previous pandemic plans did not address sufficiently the role and social responsibility of individuals. Her Highness eloquently said that in the opening remarks, that individual society responsibility and individual responsibility is really important. And we saw that in COVID, where we did not take our society with us. We had bigger challenges to implementing COVID measures. So the role of the individuals and the social responsibility of the individuals need to be better planned in future pandemic plans.
If I can ask you, Doctor, what is the biggest takeaway for you personally from this pandemic?
Well, there's a lot. First, it taught me and my colleagues that the effort we put in all our resilience plans, all our development really paid off. So in Qatar, we had been preparing for public health emergencies and for general emergencies, national emergencies, and that plan really paid off. And therefore, we need to take planning very seriously as countries. And when we get guidance and advice from organizations like WHO and others on how we should prepare for any public health emergencies or any disasters, we really need to take that seriously, and we need to prepare and not shelve that as something that may or may not happen. So that's, I think, the biggest takeaway. And one other item I wanted to highlight, which I'm really glad the conference today will be focusing on, is that over the last 3 years, the long fight against the COVID pandemic has had a very strong or a very important toll on healthcare workers in terms of their mental health, their physical health, and their social well-being. So I'm really glad that the conference tomorrow will be focusing on the mental health care of workers.
Thank you, Dr. Al-Khouari. Before I come to you, Peter, I just want to show our audience a recent Wish YouGov survey of healthcare practitioners from 6 countries and the results of that, just on the back of what Dr. Al-Khouari was saying. Now, this group, once we get it up there, highlighted a lack of financing, insufficient staffing, and lack of leadership as the 3 top factors preventing health system resilience. Peter, I just want your response to this, because obviously insufficient staffing we saw across the board in countries everywhere. But what I also find really interesting here is the lack of leadership that, you know, in order to, and we heard President Hassan say, in order for populations to succeed, they need to have trust in their health systems, and part of that is leadership.
Thank you. Well, let me start just by saying it's a great honor to be here, and I want to acknowledge the leadership and contribution of Her Excellency and Qatar. Before I get to the question about sort of insufficient staffing, health systems, and so on, I just want to make one basic point, which is that I think if we try and solve the problem of pandemic preparedness as if it's a siloed part of the health system, we're dooming ourselves to failure. It's not going to work. Because, frankly, people aren't going to be interested in investing over the longer term in something where success is defined as nothing happening. We've seen it again and again and again. It runs out of steam. We've got to get smarter at simultaneously delivering things that people care about now, i.e. saving lives, reducing infections on diseases that exist now, while building that resilience against future threats. And that's not just a theoretical aspiration, it's absolutely doable, because when it comes down to it, it is the same health workers. It's the same laboratories, it's the same supply chains, it's the same clinics that fight the existing diseases as fight the new threats. And so and we saw that with COVID-19 actually. Many countries' COVID-19 responses were built off the back of the infrastructure they had put in place to fight diseases like tuberculosis or HIV or malaria. The second thing, and here I want to build on Dr. Kouari's comments, is that and also Dr. Afeyan's earlier ones, is we need to think broader than just the sort of the narrow conception of a health system. Because there are these other actors. Private sector providers play a very big part in many countries, but critically, and this is to the point about trust, communities play a huge role. And many of the failures, particularly in the richer countries of the world around the COVID-19 response, were based on the fact that the public didn't trust what the authorities were having to say. And if you don't build that trust through the work of communities and the engagement of communities before a pandemic strikes, it's kind of too late to try and do it.
They didn't trust vaccines. There were some communities that had vaccine hesitancy as well.
But fundamentally, the trust was not believing the voices that told them what was good and what was bad. It wasn't so much whether they trusted the
health or the vaccine.
Thing. It was more about, did they believe what people were saying to them? And trust is a critical asset. If you look at which countries did well in the COVID-19 response, trust in the authorities was a massive factor. Now, you build that trust by delivering for people. You build it by countering the things that are killing their children or their families now, and helping them now, and by building engagement with communities. And I think by kind of sometimes over-medicalizing and over-centralizing the way we think about this, we've lost the sense of what that trust is. And can I raise one issue which I think comes to this point of sort of trust? We talk a lot, and it's absolutely right to talk about the inequities in pandemic response. So who gets vaccines and who doesn't, who gets treatments and who doesn't. Yet there's another level of inequity, which is who gets to say what counts as a pandemic? So this year, for example, in the world, roughly as many people will die of tuberculosis as will die of COVID-19. Yet, when you think about how much we're investing in COVID-19, in the R&D, in the political capital around it, versus what we're investing in tuberculosis, I'm afraid to say there's just no comparison. And when it comes down to it, that's because the people who die of TB are the poorest. They're the marginalized. They're the ones without voice. So when the same was true of HIV/AIDS. For a while, we called it a pandemic, and then when it stopped killing people in rich countries, we kind of changed the terminology. So as we think about the threats to human health and communities, we need to challenge ourselves to ask the equity question right at the start, not just at the point when we're talking about the distribution of medicines.
So who does get to define that? I mean, should the WHO be looking at defining other things that are impacting things like tuberculosis as a pandemic as well?
Yeah, in fact, I mean, according to the system WHO follows when it comes into labeling such diseases as either a simple outbreak or epidemic or a pandemic like COVID-19, there is a group of technical experts from around the globe. They meet, they look at each individual sort of outbreaks based on the scale, based on the numbers, based on the fatality, the transmissibility of the disease. And based on their expertise, they provide a sort of guidance to the Director General And then based on that guidance, the Director General will also look at certain key issues and areas. Then he will declare this is a pandemic, or it is an epidemic, or it is just a simple outbreak. But I fully agree with the point that you have raised. When we look at the number of deaths due to COVID, and the deaths that are due to non-communicable diseases, for example, cancer, TB, communicable diseases, TB, HIV, diabetes, hypertension, it's really far, far away than COVID. But the worry that COVID is a communicable disease, it was transmitted in a very fast manner between nations in no time, compared to, for example, TB, compared to HIV. So that's why mentally we look at this group of diseases differently than looking at outbreaks like COVID, like SARS, like MERS, for example. And that is the point. I think experts, they need to come together and agree on the turning point and when it comes into labeling diseases and outbreaks.
I just want to finally bring you back in, Patricia, Scotland. Do you worry that we're, as I mentioned there in my remarks, mindlessly walking into the next pandemic without actually heeding any of these warnings, without learning the proper lessons from the last 3 years, and we may find ourselves in a worse off situation next time? Are you worried when you speak to people, when you go and examine the health systems, when you speak to leaders, that we're just not doing enough, fast enough?
No, I'm not worried. I'm determined. Because if you look at what has happened, we are doomed if we don't understand our history. And if I look at what our Commonwealth leaders have decided in June 2022, and I'm very glad that the First Lady of Rwanda is here with us, because Rwanda is our chair in office. We have, as a Commonwealth, committed ourselves, heart and soul, to making sure that our response to this health issue is preventative, it has solidarity, and we are going to work absolutely to make sure that we learn the lessons of the last pandemic. But it does mean that we have to replenish the fund, which has gone up but hasn't gone up enough. It means that we have to work together, not just countries, but also civil society, foundations, all of us. Because if we fail to do that, we will not be able to meet the challenges of the future. And if you look at prevention, absolutely right. If you look at children, and we haven't mentioned a silent pandemic. One of the greatest silent pandemics is violence against women and girls. 1 in 3 women and girls will be affected. That's a silent pandemic we need to address. If we look at who was most disadvantaged, absolutely right, those with pre-existing conditions. We have said that we need to strengthen universal health coverage. But if you want to look at a child's possible future, we know that what a child will deliver by the age of, what we give a child at 22 months will be what that individual will achieve by 22 years. If we want to invest in our future, we have to invest in our children. Now, we have to do it all. Can we do it? Yes, we can. We just can't do it on our own. And the one thing that COVID told us was that we are one humanity, and that what affects one of us affects all of us. And if we haven't learnt that COVID was no discriminator of people, didn't care if you were black, you were white, you were religious, you were non-religious, wherever you were geographically, Mr. COVID, as I call him, came for all of us. And we, the world, have to defeat him. And if we choose, we will. And wish is one of the great ways of us coming together, looking at innovation, looking at what works, looking at what does not work. And that is what we are doing in the Commonwealth. We're sharing our expertise. We are working out what works, what doesn't work, and we are determined to be the difference we need to make in this world to end it. Let's not make any mistake. It's in our hands. There's no point in us looking at someone else to do it. The people on this panel, the people in this audience, we are charged jointly and severally to change our health dynamic. We have the intelligence, so let's do it.
I mean, I want to end on that inspiration, positive note, but I wonder how confident you are that that is. You say these inspirational words, and there are so many experts in this room who are tirelessly working, discovering vaccines and changing systems. But is that filtering through to the political leadership that we have?
Well, this is about partnership. So let me tell you what we in the Commonwealth have done. We have a partnership with the UN. We have a partnership with the WHO. We have a partnership between all our 56 countries. We are having a partnership with anyone who will partner with us, foundations, all of us, because we know that there's no point in having 197 different plans. We need one plan. And what I have said to all those who wish to partner with us is use us. We, the Commonwealth, are a petri dish of the world. You can see yourselves reflected in us. If you partner with us, if we come up with the solutions, just like those who found us the wonderful vaccine, it was 10 years' work. It may have taken 2 days to do it, but it had the 10 years. We need to put that in now. So I am refusing to accept this cannot be done. It is not impossible, and we can do it. But what I do know is we have to choose to. So I am celebrating my 56 leaders who are saying they are going to do this. And I would ask everybody else, please, join us.
Thank you. And on that note, I'd like to end this session on an incredibly inspirational note and a call to action. That also brings to an end our opening ceremony. If we can ask everyone to go downstairs for breakfast. And of course, you've got the Innovation Hub there as well as the gallery. Thank you so much for joining us here for the beginning of WISH 2022. Thank you so much. Thank you. Thank you very much.